The weather forecast with Akendogas.
Good evening, lovely viewers, and a pleasure to be in your company once again for the weather forecast. I hope you are having a beautiful evening. Between tonight and tomorrow morning, we may have a calm weather in some parts of the nation. Meanwhile, if you're in the southwest or the littoral, you may expect a cold weather tonight with moderate to heavy precipitation. We may get as low as 18 degrees in the northwest, the west as low as 19 degrees, and the Adamawa, east, center, and south regions may have temperatures getting down to a minimum of 21 degrees. D'Italy in the southwest this evening may be heavy rainfall in the entire region, and by morning it would be a similar experience with Boya and Limbe experiencing heavy rainfall. Next, we go to the littoral, where this evening may be light precipitation with as low as 21 degrees in Konsamba, and by morning, light precipitation is expected to dominate the entire littoral region. And lastly, the north region this evening may have no chance of precipitation, and by morning it would be a similar experience in the entire north region. Now, to protect yourself and others against the coronavirus, you should avoid hugging, keep a 1 meter distance with everyone, and in case of symptoms, call the number 1510. Have a good night.
France reassures the government of Cameroon of its readiness to assist in the fight against the coronavirus pandemic during two separate audiences with Prime Minister John Gote and Scientific Research and Innovation Minister. 4 health establishments engaged in unorthodox practices on the sale of fake chloroquine acquired from unidentified agents have been shut down by Public Health Minister. 13 new members of Parliament of the March 22nd rerun received their attributes this Friday during a plenary chaired by the Deputy Speaker of the House, Honorable Theophile Barrow. Get the reactions of the MPs in this newscast, and those are top stories. Good evening. Thanks for being here. It's me, Gladys Tata, on this edition of the 7:30 News. The French ambassador to Cameroon, His Excellency Christophe Guilou, has reaffirmed the commitment of his government in accompanying Cameroon manage the coronavirus pandemic as well as support its economic goals. The French diplomat expressed this commitment at the end of an audience granted him by Prime Minister John Gote and a consortium of French in the presence of a French consortium that are bringing their contributions in the fight against the deadly COVID-19. Star Building correspondent Sisa Kotamko completes that story from the Prime Minister's office.
A day after being received by President Biya at Unity Palace, French Ambassador Christophe Guilou is matching words with action as he called on Prime Minister John Gote to introduce the efforts made by France and President Macron to support Cameroon in this ordeal of COVID-19. In response to the head of state's call to support the Solidarity Fund, a consortium of French enterprises in the country accompanied him to the Star Building.
In terms of financial issues, that will represent about 200 billion francs CFA in debt relief for this year. Beyond that, on the ground here in Cameroon, we are spending a lot of money in trying to provide medication for the people who are suffering from COVID-19 in terms of equipment for hospital, for health facilities, for research, because here you have major research institutes that work with Cameroonians, for Cameroonians, and for the region, Institut Pasteur, CIRAD, IRD. And our effort today represents roughly less than 8 billion French CFA.
As part of their social responsibility, the consortium comprising 4 enterprises mobilized resources close to 36 million to provide locally produced alcoholic-based gels, incubators, cleaning equipment, and other disinfectants to be used as precaution to lower the risk of infection in health centers.
But of course, it is not for the minister, but it is for each town in the whole country. So for the north to the south, west to the east, and then we will deliver by themselves. We will deliver that to the health center for the whole country.
The enterprises are also donating funds and solar lamps to health centers in 3 major cities to fight against COVID-19.
In a related development, the French diplomat was equally granted audience by Madeleine Chuente of Scientific Research and Innovation. During the audience, he reassured his country's willingness to accompany Cameroon fight the coronavirus pandemic by providing funding for research. Renato Sali caught up with His Excellency Christophe Guilloux, who now throws more light on today's discussions. Let's have a listen.
The idea behind this is that France supports the research. We are facing a very serious epidemic, and France is there to accompany and to support the efforts made by the government and the people of Cameroon to face the pandemic. The research is at the forefront of the fight against pandemic. We're making a lot of effort to fund the fight as a first step. It's an emergency funding that we're providing to the people of Cameroon, and to be very concrete, it goes up to 10 million euros. That means almost 700 million French CFA, and that is medication, it's treatment, it's supporting hospitals, supporting also NGOs that will come to the people who are facing the COVID.
Cameroon will not be expected to honor debt service obligations to France for 1 year, while the government focuses on stemming the spread of the coronavirus. The decision was arrived at recently, while material aid had equally been announced by France to enable Cameroon strengthen the health system and protect the most vulnerable population. Clarice Aritakang explains.
The debt service rescheduling initiative follows calls from African states to development partners to rethink financial cooperation prerogatives as they grapple with the bludgeoning impact of the coronavirus on their economies.
We are spending 7 billion French CFA into supporting health system. We will have an addition of 1 billion to support research institute.
The debt is bilateral and global. Cameroon, like other African countries, is hoping to be given time to reinforce economic resilience, strengthen private sector contribution to growth, reboot domestic resource mobilization, all the while ensuring debt sustainability. For 1 year, France will not be expecting a dime in the form of loan repayments from Cameroon.
The decision taken by the G20 and the Club de Paris is to cancel the debt that Cameroon owes to different countries and different institutions for 1 year. Just for 2020, are 60 billion owed to France. The condition is that Cameroon will spend that amount of money, support health system, assist households who are suffering from revenues due to the crisis.
Discussions continue on the global scene in view of the implementation time frame for the debt relief exercise.
And on to one of our lead stories, 4 health centers in Yaoundé have been sealed by Public Health Minister Manaouda Malache. The health establishments were shut down for selling fake chloroquine, illegal practice of the profession of pharmacist, the acquisition of drugs from unidentified agents, amongst others. Gilbert Ongene visited these health structures and has the details.
We are here in the BMRC neighborhood in Yaoundé. These are patients stranded at this health center, shut down indefinitely for illegally selling chloroquine.
I came here to get medicine for my brother, but unfortunately the place is locked, so I'm forced to go back. I cannot really say it's a pharmacy, but we buy drugs, so it's normally, we can call it a pharmacy.
Nearby at Monté-Jouvence, another health center has been clamped down with the same sanctions for carrying out similar activities.
We are very glad for that shutdown, because that health structure have not the quality to make the prestation.
Elsewhere at the Nouvelle Route Omisport neighborhood, this pharmacy is sealed for 30 days. The owner is accused of the procurement of drugs from an uncertified agent and the sale of chloroquine without authorization.
We understand also that measure of the ministry, because there are some people who are moving against the law.
At a time when the world is grappling with a major health crisis, citizens ought to be more vigilant on what health structure they go to for medication.
8 councils, which make up the Mefu and Afamba division, have received sanitary and protective equipment from the Association for the Development of Mefu and Afamba division, dubbed ADEMAF. Senator Sylvestre Naundua, Vice President of ADEMAF, handed over the materials this Friday in full. Christian Che-Atam was there and brought back the following report.
The consignment offered by the Mefu and Afamba Development Association to the 8 councils of the division is made up of sanitary materials, protective equipment, and communication gadgets. Estimated at 6 million francs, the donation is meant to boost the capacity of councils in the division to tackle health challenges, especially that posed by the COVID-19 virus. Speaking on behalf of the 8 beneficiary municipalities, the mayor of Kolafamba, Jean-François Odigi Owona, hailed the initiative as a timely gesture. He has saluted the collaboration between the Vice President of the Senate, Sylvestre Naundua, and all other members of the elite of Mefu and Afamba division who contributed towards the initiative.
The elite from the Mefu Afamba are people who know exactly what the problem is. You cannot leave the government take the measures by himself. We also help the government to fight its virus and make things easier for the government. So to help, to give some money maybe, mainly to inform our people that to have to stay to what the government said, and maybe to give some equipment to help them save themselves.
The president of ADEMAF, Sylvestre Naundua, explained to the population that money for the initiative was mobilized within 10 days and is an expression of the commitment which children of Mefu and Afamba division have for the well-being of their brothers and sisters. He has called for a judicious use of the materials by the 8 councils to supplement efforts already being made to check the arrival and spread of COVID-19 in Mefu and Afamba division.
The fight against the COVID-19 pandemic has intensified in Meganga, capital city in the Mbere division of the Adamawa region. CPDM parliamentarian Honorable Halia Musa has donated a consignment of goods of basic necessity and face masks to the population, while calling on them to support the state in the fight against coronavirus by respecting all preventive measures put in place by government. Details with Celestine Sumbele of CRTV Ngaoundere.
Friday, April 17, 2020 shall be remembered as the day the first positive case of the COVID-19 was diagnosed in the Adamawa region. According to officials, the individual is a native of Ngaoundere who came in from abroad.
I've just recorded a case. One citizen who came from abroad just recent, and he entered to our town without being checked. And some days after, we obliged him to be checked, and the result today is positive.
The patient has been isolated, and health workers have launched a vigorous search to track all those who may have been in contact with him.
An opportunity for us to call on the population of Adamawa region to be very conscious that the disease is among us, and we have to be careful.
Officials say over 40 rooms are already available, plus a well-trained team to handle any other case. They, however, caution the population to call the toll-free number 1510 if they notice any suspected case.
And as you heard, that was Elise Banmia reporting there on the first case of the coronavirus in the Adamawa region. And this press release from the Minister of Communication, and it reads, the government of the Republic has been following with much astonishment the smear and stigmatization campaign led against Cameroonian institutions by some foreign media and unscrupulous politicians in relation to the management of the COVID-19 pandemic in Cameroon. This campaign, conspicuously masterminded by some behind-the-scene actors and denigrators by bad faith, comes in at a time when Cameroon as a whole is mobilized behind the head of state, His Excellency Paul Biya, to stop stop the progression of the COVID-19 pandemic and minimize as much as possible its impact on the health of population living in Cameroon. These media and politicians pretend that neither the preventive and restrictive measures personally prescribed by the head of state and reiterated time and again for about a month now, the strong and innovative operational arrangement made by health authorities under his high guidance, nor the commitment of healthcare professionals mobilized throughout the national territory are sufficient to attest to the fact that there is a national response strategy being implemented in Cameroon, that this response is carried out methodically and rigorously, and that it bears encouraging fruits on a daily basis. The government of the Republic strongly rejects such are both unfair and despicable. And the government equally reiterates that populations living in Cameroon have benefited and will continue to benefit from all the attentions of the powers that be in order to curb this pandemic from elsewhere that our country has to face, just as many other countries worldwide. In this regard, besides the barrier measures prescribed by the World Health Organization, the government has launched the National Response Strategy comprising strong measures including quarantining and people from strongly affected countries as well as suspected cases, the anticipated detection of the virus through mass testing, the extension of testing and care centers beyond the city of Yaoundé, the substantial increase of capacity of country health facilities and use of unoccupied social housing in various regional chief towns, the improvement of a treatment protocol, and more recently, the authorization given by the head of state for the local production of hydrochloroquine and azithromycin molecules for use as part of the approved treatment protocol. In addition, beyond public awareness initiatives, the government has launched corrective actions in order to enforce the observance of prescribed measures, including the systematic boarding and impoundment of any vehicle violating the said measures, as well as the closing of restaurants and drinking spots that are open beyond authorized hours. It should be pointed out that the 13 measures initially prescribed by the head of state and made public by the Prime Minister head of government on March 17, 2020 were followed by 7 others, including the obligation under penalty for everyone to wear a face mask in a public place throughout the national territory as from April 13, 2020. Last but not the least of measures is the setting up by the President of the Republic on March 30th, 2020 of a special solidarity fund for national COVID-19 response. In this light of the foregoing, the Cameroon government rejects all erroneous statements and biased comments of some ill-advised foreign media and politicians of bad faith on the management of COVID-19 health crisis in Cameroon. Moreover, rather than public speeches that some seem to be clamoring for, what matters for the Cameroonian people is the concrete action and the many guidelines prescribed by the President of the Republic and implemented by the government. The government also warns those media and politicians who persist in their attempts to misinform and manipulate the national and international public for covert purposes. In any case, the head of state, His Excellency Paul Biya, the government of the Republic and the entire Cameroonian people, perfectly conscious of the seriousness of the situation and of the necessity to face it, continue to join efforts with friendly countries and international partners to contain the spread of the COVID-19 and minimize its negative effects in Cameroon. And this communique has been signed by the Minister of Communication, René Emmanuel Sadi, on the 16th of April 2020. The mayor of the Bamenda 1 Council, Felix Biga, says owners of sheds in his municipality will not pay rent for the next 3 months. This move is meant to enable the traders keep some money to pay for other sheds when they quit the vicinity in the next months. CV Banta tells us more from CRTV Northwest in Bamenda.
The Bamenda 1 Council area has in the past months witnessed an influx of petty businesses ranging from provision stores to drinking spots and other commercial activities. Most of the business premises are stationed haphazardly without considering town planning prescription.
We've given them deadline to leave custom, giving them 3 months for free for those who will be leaving custom to go to the market, so they can start business there and maybe gain back their customer gain their capital before they pay.
With the adopted budget for the council, which stands at over 388 million CFA francs, the construction of interquarter roads, provision of social amenities, including potable water, will take effect after fieldworks have been completed.
As a new team has been put in place, I believe that we will work hard to see that we will redouble what we had today before the next accounting session.
Bamenda 1 municipality is one of the major gateways into the city of Bamenda. Thus, the fight against the outbreak of the coronavirus in the region is one of the main activities in the council area.
The Association of Young Patriots with President Paul Biya has called on traders of the Mokolo market in Yaoundé to accompany President Paul Biya in the fight against the novel coronavirus by respecting government measures to control the spread of the pandemic. This was during a sensitization tour during which the members donated hand-washing equipment, masks and sanitizers. Ate Bonaventure tells us more.
It is the usual hustling and bustling that characterized the Mokolo market, with little respect of social distancing and other laid-down recommendations against the pandemic. The Association of Young Patriots with President Paul Biya Japabi donated hand-washing stations, soap, sanitizers and nose masks to traders while advising them to adopt frequent hand-washing and wearing of masks as healthy habits.
The youth is showing his support to the President Paul Biya. That's why we are here in the Mokolo market today, so to sensibilize the population about the preventing of COVID disease.
The campaign, led by the association's coordinator, Steve Michel Aka, took the young patriots to the different sectors of the market.
We are fighting that disease. We have sensibilized the population. We have made the distribution of shop, of hydroalcoholic solution, and of masks. So that's why we are here today to show our support.
The exercise is to continue in other subdivisions in the days ahead.
Let's now take you over to the Public Health Emergency Center here in Yaoundé to meet Baldwin Stammer, standing by live with latest updates concerning the coronavirus in Cameroon. Hello, Baldwin. You have the floor.
Well, good evening to you, Gladys Tata. You welcome to the Public Health Emergency Center this evening, where I should say there is good news for Cameroonians as concerns the number of persons who've recovered so far from COVID-19 in the country. As of tonight, we have 177 confirmed cases of Cameroonians who've recovered from this deadly virus. This information was confirmed to us a while ago by officials of the Ministry of Public Health here in Yaoundé. And since we're talking about Cameroonians who've been able to recover so far from the coronavirus in the country, emphasis tonight is how to manage cases who've recovered so as to avoid a situation where they get reinfected once more. And as resource person tonight, we have Manuela Ngo Bakale, who is Public Relations Officer here at the Public Health Emergency Center. Good evening, Manuela.
Good evening.
Tell us, has research been able so far to confirm cases of persons who've recovered from COVID-19 and once more get reinfected?
Well, it is good to know that to develop immunity, it means that your body has been faced with the characteristic of the disease. Either it is a virus or something else. And then to protect your organism, it develops a kind of barriers. Then for COVID-19, so far, it's a new disease. Research are going on. It means that we are just trying to manage with what we discovered as different characteristics. But for the moment, there is no case which has been referred as like having already developed immunity.
Let's say the example of South Korea, where reports talk of 144 persons who recovered and later on got reinfected. Is it that they did not develop immunity to this disease?
Well, as we said, we cannot really affirm that they have not developed the immunity. But as far as they has been reinfected, it means that maybe the immunity is not yet it's not already in the body. So for that case, what we can develop is that when we have vaccines against measles or against poliomyelitis, you know that I am protected for a period. Then for COVID-19, we cannot say that maybe we have developed an immunity of 1 day, 3 days, or therearound. So it's better to say that, well, no one has, for the moment, developed any immunity. But as we said, research are going on.
And finally, Cameroon, so far we have 177 persons who have recovered from COVID-19. What measures have been put in place to avoid a situation where any of such persons can get reinfected once more?
Well, to avoid to be reinfected, it is basically respect all the various measures that has been preconized to the population, such as respecting hygiene rules, then keeping on with social distancing, and also wearing the mask, and well, keep on checking yourself, because once you have recovered, as we said that there is not any certitude that you have developed any immunity, you need to check your body to make sure that you will not get reinfected, and also all those rules that we have already talked about. So it's yourself you should manage, and the government at his level is just trying to give some mechanisms, some advice to help people not to be reinfected.
Thank you so much, Manuela, for being available as a resource person on the 7:30 newscast. Well, Gladys, there has been a lot of satisfaction from officials of the Ministry of Public Health as concerns the positive response from the public, with many Cameroonians who have been respecting most of the measures outlined by the government to fight against the spread of the COVID-19 in Cameroon, especially that concerning the wearing of a face mask in public places in the country, with most Cameroonians who have equally been calling the toll-free number 1510 to get to know more about some of the signs or symptoms of the COVID-19 in the country. And the take-home message from officials of the Ministry of Public Health tonight is that Cameroonians should continue scrupulously respecting these government measures, especially those that have to do with hygiene and social distancing, because by so doing, we together contribute our own quota in stopping the spread of the COVID-19 in Cameroon. Live from the Public Health Emergency Center for the 7:30 newscast, Baldwin Sama. Back to you, Gladys.
Thank you very much, Obodin Sama, and you too should keep safe. Former Prime Minister Philemon Yang has been appointed Grand Chancellor of National Orders. He was appointed late this evening by President Paul Biya to replace Peter Mafani Musonge. Charles Ebune reports.
And here he comes, Philemon Yang, Cameroon's longest-serving Prime Minister, almost 10 years at the Star Building, today appointed by the President of the Republic as the Grand Chancellor of the National Orders.
My first impressions are very good. I am very thankful to the head of state. This is another opportunity for me to serve the President and serve the nation.
The former Cameroonian High Commissioner to Canada and one-time Assistant Secretary General of the Presidency of the Republic has had confidence in him, renewed by President Paul Biya, who appoints him to head the institution which hands national distinctions to Cameroonians and foreigners.
There are definitely challenges because I know nothing about the job, but I am totally convinced that I am going to learn, and I should be able to do a good job before long, because I believe service to the nation ought to be taken very seriously.
At this time of the coronavirus, which has infected more than 2 million people worldwide, the former head of government has this message for all Cameroonians.
And I would ask all Cameroonians to follow all the rules which have been given by the head of state and by the Prime Minister. because it is important that we protect our nation, protect ourselves, so that we will have an opportunity to fight effectively against this disease, which will spare nobody who is careless.
The former Prime Minister replaces Peter Mafanyi Musonge, the current chairman of the National Commission for the Promotion of Bilingualism and Multiculturalism, as Grand Chancellor of National Orders, with President Paul Biya as the Grand Master.
Congratulations, Your Excellency. The 13 members of the National Assembly who were elected during the March 22nd parliamentary rerun have received their attributes. This was during a plenary sitting presided over by the Deputy Speaker, Honorable Teofilo Bauro, in the course of which the members were declared lawmakers with no positions of incompatibility declared. Esther Kima attended the plenary and sought the reactions of the new MPs.
The solemn plenary sitting was solely dedicated to the validation of the mandates of the victors of the parliamentary rerun. After the presentation of the report of the Fourth Verification Board, which recorded no cases of incompatibility with the position of member of the National Assembly, the elated members, adorned in their sash and in possession of their insignia and rosettes, expressed their joy and readiness to serve.
I feel extremely happy. Today is a day the Lord has made. Let us rejoice and be glad in it. It's a long-awaited day.
There were many challenges on the way. Finally today, here I am. I'm so happy.
After going through this exercise twice, I should naturally be happy that I've joined the other parliamentarians of the nation.
I'm very happy for what has happened today. And I promise that I will do my work as a parliamentarian.
Though new to the mission, they already have well-carved-out plans for the development of their people.
I'm going to embark on developmental projects in terms of infrastructure to connect the network in a division.
Without peace, there's no development. After this, we have to fight this virus. We have to now create what you call creativity in the youth.
It is conferring an enormous task, that of enacting laws for the nation.
The road network is not very good. We need more schools. We need health infrastructures. The legislative house is a place for me to contribute my own quota to ameliorate the laws in Cameroon.
For the old-timers, peace remains primordial in all reconstruction efforts.
It is high time for us to construct our country. Nobody will come and do it for us.
You know, we are extremely happy with the decision of the head of state to create the reconstruction board.
The clocked members can now officially join their colleagues to make a full house of 180 in the legislative process.
The Minister Delegate at the Presidency in charge of Defense, Joseph Betia Samo, has paid glowing tributes to wounded soldiers at the military hospital here in Yaoundé. While delivering a special consolation message on behalf of the head of state, he urged the strict respect of safety measures to check the COVID-19. Minister Betia Samo equally visited the production center at the military headquarters where face masks are being produced, as Constantine Baum tells us.
The head of state, commander-in-chief of the armed forces, has always remained close with the army. Even those wounded in the line of duty commune with the head of state through such visits, where the minister delegate at the presidency in charge of defense, Joseph Betia Samo, delivers a consolatory message to the war victims. The ceremony started with a minute of silence in honor of security and defense forces who fell in the line of duty. This was followed by the presentation of the pathologies of the soldiers at the Yaoundé Military Hospital.
People who have been able to go through their treatment here are put in two main categories: those that can go back to join their units and probably go back to the battlefield, and those that have suffered some lesions that are incompatible with service, and they have to be reclassified and put in positions where they might not need all of their physical capabilities to serve.
The injuries speak of the brutality on the battlefield, with some carrying marks incurred from landmines and grenade explosions, notably in the fight against Boko Haram, insurgency and separatists in the northwest and southwest regions. While saluting the sense of service and sacrifice of the war victims, Minister Joseph Beti Asomo urged the strict respect of safety measures to ensure that the COVID-19 pandemic becomes no problem to the victims on their recovery beds. He also enjoined the military medical personnel to be morally armed to play a key role should they be called by their commander-in-chief in the fight against the coronavirus. He also visited the confectioning of military material situated at the military headquarters brigade. The team, made up of both military and civilian personnel, are not working on military uniforms but on the production of face masks that has to be distributed to all units of the army nationwide. A target of 10,000 face masks has to be produced per week, a huge task, and the minister called on them to forget and sacrifice their weekends because the virus knows no weekend. He as well called on them to be ready at any time because their services might be needed as well to produce masks for the civilians.
The Minister of Public Works, Emmanuel Ngano Jumesi, has carried out a worksite evaluation visit on the Yaoundé-Douala motorway under construction. After an inspection tour on the site, Minister Ngano Jumesi noted that work is at 80% executed on the first phase of the project, consisting of 60 kilometers long. The deadline for completion of this phase is 31st of December 2020. Joyce Kimbi Fowaju tells us more.
Slowly but surely, the Yaoundé-Douala motorway is emerging from the thick equatorial forest. The first phase of 60 kilometers long, 40 kilometers of it is already completed, while grading, rock crushing and construction of culvert are advanced on the remaining 20 kilometers of this first phase, totaling 84% of work executed.
It's practically finished. Between PK 40 to PK 60. You can see from the site that we just have some cut off rocks still remaining on our site.
Though challenged by unpaid bills, the construction company told the visiting Minister of Public Works and his team that it is possible to finish the works by December 2020.
If we have the money, we will try our best to do it.
The pandemic, COVID-19, has not affected the pace of construction work on the Yaoundé-Douala motorway. Several sanitary measures, like the obligatory wearing of face masks and washing of hands, as well as social distancing, is being respected by the staff.
Thanks for watching. At 8:30, you'll meet Atabadine Umar for the 8:30 news in French. And take the rendezvous tomorrow, same time at 7:30. Until then, it's bye from all of us on this 7:30 crew. Good night.
Oh.